According to a new Ipsos survey conducted for the Ontario Medical Association, most Ontarians want the government to clear the backlog of surgeries and procedures built up during the pandemic, even if that means a short-term impact on the economy. Doctors have said the best way to blunt the impact on hospitals is to get the vaccine, but these survey results also reveal millennials or Gen X women are more likely not to get the vaccine. 1 in 4 unvaccinated respondents say they're afraid of side effects. They don't trust information coming from the government. And Health Minister Christine Elliott today addressing vaccine hesitancy, saying it's unacceptable that doctors are spreading misinformation, promising to write to the College of Physicians and Surgeons of Ontario, urging them to do everything possible to put an end to this behavior. Joining us now with more on this tonight is Dr. Adam Kassam, President of the Ontario Medical Association, Sandra Guiry, Senior VP of Public Affairs with Ipsos, and family physician Dr. Kiran. Thanks to all of you. Dr. Kassam, how backlogged is our healthcare system right now, and what does this data today reveal about our level of concern about this?
So let me first acknowledge the challenging times that we find ourselves in. The public has made tremendous sacrifices, and that includes parents and students. It includes small business like retail, restaurants, gyms, and as a frontline physician, I've seen the impact that COVID-19 has had on my patients and their families. And as you just brought up, the pandemic backlog of care is one of the most pressing issues facing patients. And in fact, our recent data show that this is a key priority for Ontarians. What Ontarians are saying is very clear. We can't have an economic recovery without a healthcare recovery. And 20 million healthcare services have been delayed as a result of COVID-19. So that's someone's hip or knee replacement that's gone delayed. It's someone's cataract surgery that's gone delayed. It's someone's cancer screening like a colonoscopy or mammogram that's gone delayed. It's access to primary mental health and tertiary care services that have gone delayed. And there are a number of ways that we believe that we can get through this backlog, and it's why we've been encouraged that 96% of Ontarians agree with the OMA's prescription for Ontario, which we believe is a roadmap for the future of healthcare in our province.
Okay, and Sandra, this survey was done, we should mention, in December. So before Omicron, before non-emergency surgeries and procedures were paused by the province, the situation we know now in hospitals is just so much worse. So help us understand how relevant all of this data is today.
Yeah, the surveys, as any survey, is a snapshot in time. And as you mentioned, the survey was done in the early part of December before the big influx of Omicron in Ontario. But I think the results are really reflective of data we've seen all the way through the pandemic. And I think that the evidence that suggests that Ontarians are, for the time being, willing to trade off economic recovery investments for health investments until the surgical backlog is cleared, I think that holds true today still.
So what does that mean? Does that mean that most people in Ontario, according to this survey, would rather see the government put money into healthcare, into staffing, nurses, doctors, instead of these businesses that we know are also suffering?
Yeah, there's no question these are competing priorities, and certainly there's importance among the public for all of them. The fact is that a lot of this is about making trade-offs, and what we know from our respondents is that the healthcare system and access to it is still the number 1 priority. When you ask them to sort of consider that in the context of economic recovery, you do find that more often than not, the evidence weighs in the favor of investments in healthcare for the time being.
So, Sandra, also doctors have said the only way out of this is vaccination. We've heard this time and time again. So why are millennials and Gen X women, according to this survey, most likely to hold back on getting the vaccine?
Yeah, well, I think Gen X and millennials, women, but also men, I think they are not unlike many people in the sense that they have some trepidation or fear about the safety of the side effects. And also some mistrust of information is out there that's causing people to take a pause. But what we found in the data, specifically for millennials and Gen X, was that that group, more so women, has decided that it's their personal choice to not get the vaccine. And that is weighing into some of their decision making.
So Dr. Kiran, tell us about some of the concerns you're hearing about from patients.
I think patients are also just very confused right now. Things have changed so quickly. It used to be the messaging that, when you had symptoms, go get a test. And then all of a sudden we switched to messaging, actually tests are reserved. If you have symptoms, assume you have COVID. And then, public health units were calling people to tell them what to do if they tested positive for COVID. But now it's really up to individuals to kind of read that guidance, figure out through their social networks what it is that they should do if they have symptoms. So how long should they isolate for? Who should they contact? Like, what's the definition for a close contact? And how long should their close contacts isolate for? What's one of the things that I think is really important out there is, many people with COVID can't manage to recover on their own, especially if they're fully vaccinated and younger. They can manage to recover on their own at home without seeing a doctor or nurse. But there are some people who are going to get very sick, and there are some people who are more vulnerable who probably should call a doctor for extra monitoring, or also because they may be qualifying for new treatments. And we know that many patients aren't really aware of that guidance. So who is it that should be calling a doctor? When should you be calling a doctor? And when is it that you instead should be going to the emergency room? So one thing that we've really tried to do over the last bit is issue this some new resources through our department at U of T, as well as the Ontario College of Family Physicians, called confusedaboutcovid.ca, where if you have a question, you can go there, and it's a one-stop shop to get some of those clear answers.
And you mentioned about how, we're hearing these stories, people ending up in ICUs and hospital beds with COVID-19, people who were not vaccinated. And now we're seeing, a lot of people share stories on Twitter, on Facebook of my uncle or my dad or, a relative turned up in a hospital. They're not doing well with COVID. They didn't get the vaccine. And now they say they really wish that they did. Dr. Kiran, in your experience, anecdotally, what's leading to those situations? What are people really misinformed about?
Yeah, so I think mistrust and misinformation are two of the biggest factors leading people to remain vaccine hesitant. And that mistrust runs deep. So often it's because they've had terrible life experiences in the past that legitimately cause them to distrust our governments or science, pharmaceutical companies. Sometimes those experiences are here in Canada. Sometimes those experiences are overseas. Sometimes they're related to family trauma, for example. Sometimes they're actually just so overwhelmed by their own life that it's hard for them to make space to kind of really parse down things. And I guess, the flip side of mistrust, not the flip side, but the other factor, misinformation. What I'm seeing is a lot of, patients of mine who are hesitant to get the vaccine still. It's because they have gone on they've gotten messages from social media and also from their social networks about the vaccine that's just not true. And it's hard to counter those messages. So they trust me. I've been their family doctor for a long time. And, we've had to have many, many, many conversations. And actually just today I learned that, somebody that I've had many conversations with went out and got their first dose. And I was, so pleased. So I think those people's minds can be changed, but it takes many conversations to actually counter the degree of mistrust and misinformation that's out there.
Yeah, certainly a victory. Dr. Kassam, I'm sure you heard this today. The health minister was talking about this problem of misinformation. Minister Elliott saying she's going to write a letter to the college about this as well. How big of a problem in this is this? And is that encouraging to hear the health minister sort of taking a step forward on this note?
So as an organization, we have been very clear from the very start. And just like my colleagues have already described, vaccines are safe, they're effective, and they represent our best protection against COVID-19. And physicians have been largely leaders in both advocacy and education around the importance of vaccination. It's why we've called for, as an organization, for mandatory vaccination of healthcare and education workers. It's why more than 98% of physicians, of the 43,000 physicians in this province, are fully vaccinated and continue to spearhead initiatives like Dr. Kiran's as far as vaccine education, misinformation, and administration. It's why I spend my weekends with my physician wife vaccinating across the GTA and underserved communities. And so the CPSO, of course, is positioned to answer questions around regulations and discipline of the profession, but our focus is going to be on continued education of patients in our communities to ensure that they have the best information to make the best decision about their health care, and we're going to continue to encourage vaccination of all of those eligible.
Okay, a very interesting conversation. We'll have to leave it there for now. Thanks for your time to all of you, Dr. Kassam, Sandra, and Dr. Kiran. Thanks so much.
Thank you.
Thank you.